So we see, when we say the comprehensive breast program mainly at University Medical Center, where we see the majority of our patients, we are definitely talking about patients that are diagnosed with breast cancer, but there is a whole spectrum of other diseases of the breast which have nothing to do with breast cancer. It could be something as simple as the patient feels a lump at home and they're worried about it. We see those patients. We see patients who go in to get their screening mammogram and there may be an abnormality on that mammogram. We see those patients as well. So there's a lot of, another common one that we see is something as simple as breast pain. What causes breast pain? And so we see the full spectrum of diseases of the breast, which is both cancer and non-cancer type diseases. A lot of these patients really don't know what their reconstructive options are at the time. All they're really concerned about is, I got to get this cancer taken care of. And so the discussions that I have with patients about their breast cancer are detailed. And then they follow up with a second consultation with our plastic surgeons. We all sit down and we answer all their questions to make sure they have a good understanding of what their options are and that they don't leave that office on that visit with any questions about what their options are. Now we have so many surgical options for these patients, which range from breast conservation therapy, which is trying to preserve the breast, the remainder of the breast, but removing the tumor. We talk about lumpectomy, and then there are other types of surgery that some patients may require, which would be a mastectomy. And along those lines, it becomes a longer discussion about what are their options. So if I have to do a mastectomy on a patient with breast cancer, how can we reconstruct the breast? And this gets to our team approach, where our LSU plastic surgeons are world-renowned for the type of breast reconstruction that we can perform for these patients. One of the newest things that we're doing is called hidden scar surgery, where I can make a small incision about 4 inches long underneath the bottom part of the breast here, preserve the nipple, and remove all of the underlying breast tissue, and then have the plastic surgeons come in at the same operation, and then the patients can wake up in many cases with their final implant in place. And this is something that only the LSU Healthcare Network is offering in this community. One of the advantages of the LSU Healthcare Network is the many locations that patients can get seen. You know, we're able to see patients at the St. Charles Clinic with the LSU Healthcare Network. Also at University Medical Center, we have a beautiful cancer center there on the first floor in the first tower of the University Medical Center. And I'm able to perform operations either at University Medical Center or also at Touro Infirmary Medical Center as well.